Welcome to the Occupational Safety Leadership Podcast, episode number 119. In today's episode, we're going to do just a really quick introduction to the OSHA Permissible Exposure Limits. We'll kind of go over, here's a couple of the acronyms that you'll find. We're not going to dive into any chemical specific things, but just kind of how do you read the chart? How do you understand it? Is it based off of what duration of time? So let's just kind of go over a couple things here then. So, well, first off, for the OSHA PELs, it's based off of a 8-hour workday or 40-hour work week then. So with this one, what they're saying is this is the concentration that you can be exposed to without suffering effects then from it then. Um, like all things, of course, I always say shoot for zero or as low as you possibly can, just because, sometimes it takes science a little bit of time. Correction, it takes technology time to catch up with science. And when we think about things in the past that we thought were pretty safe and harmless, such as smoking, asbestos in the early part of the century, things like that, we now know that takes a little bit of evidence, it takes some years, it takes some putting the dots together, and then you can start to see where there's a health issue out there. So I always tell folks, do everything you can to be as low as you can, and in an ideal world at zero when it comes to chemical exposure. I'm not sure when it comes to everyday pollutants. That's a 100% thing that we can really achieve here. So, okay, so I'm off my soapbox. I've deviated here, like right from the get-go. So let's just kind of go over some more things. So the way OSHA sets these is they sit down, of course, and they look at things that are like recommendations from the American Conference of Governmental Industrial Hygienists and other scientific bodies. They present their evidence and then say we believe that a PEL should be lowered to the following or set for the following, because some of them are not even set yet, whereas others go down and then they'll typically ask for a lower limit. I've not seen where PEL has ever been raised. I'm sure that it's out there at some point in time. So the PEL is also the legally enforceable exposure limit. In the next couple of episodes, we'll sit down and look at other bodies that kick out these recommendations and say this is your maximum of a chemical that you should be exposed to. And that's awesome and great. And we should always strive to look at that data too. But when it really comes down to what's legally enforceable, that's going to be the OSHA PEL. Let's switch gears little bit here and just kind of talk about how when you look at that concentration and in the list of PELs, there's hundreds of chemicals in there. Everything is going to be off of a time-weighted average of an 8-hour workday. So you will find some that have a acronym of STEL, STEL, which stands for a short-term exposure. And so this is something that should not be exceeded for a 15-minute period. So also, you can have what's called a ceiling next to your number, which is going to just be a capital C, and this can never be exceeded. So that's going to be, like the word says, the ceiling that's out there. There are a few out there when you think about like lead and silica and things like that then that are going to have a action level. So let's just say for the sake of argument we do some easy math and chemical A has an exposure of 50. They could set the action limit at 25 or 30 ppms to basically say you don't have to do anything. But if you're going to exceed that 25 or 30, you have to put the following mechanisms in place. And it might have medical surveillance, it might have a respirator, it might have all that kind of stuff then. But you still can't go over 50. But if you go over whatever they set it at, that 25 or 30, you got to do the following. So you will see at times there's a few that have a action level on there. And so one of the things that I'm asked often is that, so what happens if I don't really know what the level is out there? Well, it's up to the employer to monitor the workplace air and figure out exactly what that level is then. I wish that I had some kind of Superman vision and I could look at a cloud of either dust or a chemical mist or something and say, I can tell you exactly what that is. It's the following ppms, or it's this, or it's that, and you really don't know unless you go back and monitor and have that data. I do know some folks are kind of scared about monitoring that data because maybe they didn't know it, and now that they've kind of discovered it, they have to tackle this problem. They're also a little scared that maybe this was a problem that they just didn't know was out there, and now that they know that it's out there, it appears as if they were just blowing it off the whole time, and not that they were blowing it off. They now think they have a problem. They now recognize they have to do something with monitoring of the air. So it can cause a lot of anxiety. I like to do it as much as I can because it really helps me to confirm things like I've done everything I can by putting a engineering control in place. If I really have to, you put a respirator on somebody, you do all that other kind of stuff then. But just you've done everything you possibly can to engineer out that hazard because all of us are flawed humans. So anytime that we can get rid of that hazard, it's going to be a nice bonus for us then. So. And that's it for today's episode. Just nice, short, sweet. We just kind of did a little intro to the OSHA Permissible Exposure Limit. Um, this is episode 119. My name is Dr. David Ayers. Please like, subscribe, leave a comment. That really helps me to get better. That really helps the podcast to be seen and heard more from folks out there. I'm doing this so that, and I hate to say I'm getting old, but I'd like to pass along any bit of knowledge I can to that very next generation that's coming up, or for somebody who maybe hadn't heard an issue from a different perspective, and it just really get good and help the people out there. So this episode is complete. Thank you for joining me. My name is Dr. David Ayers. Thank you, and have a safe day.